microphone. My name is Bob Martelli. I'm a former journalist for the Boston Globe. Spent 20 plus years working in communications and marketing. And I will say, professionally and personally, this organization has changed the trajectory of my business and my life, and here's how. And 4 or 5 years ago, I was going through a transition from my business and the agency that I was running, and wanted to separate from a kind of a money-driven, kind of capitalist tech environment to more mission-driven work. I happen to speak to a lovely woman formerly from Everett, Massachusetts, Rhonda. I have a lot of energy and I'm the bull in the china shop, but she is the bull in the china shop. Whenever she's on, I want to work with her, and to this day, all my work is focused on working with organizations that are mission-driven and impact-focused. I want to work with good people doing good things. And the stories I hear from Nimo, the team, the board, Doug, all the way down from Lisa's story that was in the Globe a few months back. It's so impactful, and the work that you do is hands-on, and it happens over time. So adjustments, absolutely, federally, locally, but also times it happens right here, right? And that's what today is about. Take this energy. As my grandfather would say, less job, more Paul. Let's get the work done. Let's get into it. So I'm going to try to get us up on time, so we're a little pressure time here. But my job as an annoying former reporter is to ask these really talented ladies some questions about what they spoke about today, or context. And if there's questions that you want to ask the panel here as we get into it, feel free. You like microphone? Yes? No? Think so? You good?
Yeah. Why don't you hand it? Let's use it just in case.
All right. So my first question, now that you know, based on your context of your presentation and understanding where the organization is going, what's Hearth's role from your perspective in moving this forward in this mindset of adjustments?
Well, I think this role of elevating older adult homelessness, and as you've been doing, being an advocate on it, a provider of quality housing and programming is so important. And, you know, continuing to both do that day-to-day work and engaging with organizations like ours to be part of our kind of bigger picture work around the state. So critical.
And from an adjustment perspective, Nimo, you have all these stories, right? We hear these stories all day long. And 2 years ago it was about soaring. A year ago it was about inspiring action. And now it's about making those adjustments and getting into the work. From your perspective on the day-to-day workflow, what does that day-to-day work look like? And why do you continue every single day to show up and do the work?
First of all, you gotta love what you do. The work we do is not an easy work, which requires us to adjust on a daily basis to ensure that our residents and clients that we serve, that we provide the support and the resources that they need, which means making sure that they adjust into a new environment, into new pieces of staffing and neighbors that they come. So the day-to-day work is always just a fluid of adjustments, regardless of what kind of support we provide.
From your perspective, what do these adjustments look like in the next 6 to 12 months? Outside of what's going on politically, but you know, a lot of the work happens on the ground, right, day to day. From your perspective, maybe you look at the data, what do these adjustments look like in the next 6 to 12 months?
It's a tough time. You know, I was showing a map of where there are units all around the state that have this immediate risk. Some good news for Hearth, and immediately we don't have a lot of units, but there's some that you're affected by. It's all of us kind of working together to understand what this impact is going to be, and that we work and continue to push our state administration to be a part of working on solutions, so it is not left to every nonprofit to kind of figure this out on their own. We need to be doing this collectively.
Takes the proverbial village, as they say, right? From your perspective, Nimo, what's the next 6 to 12 months look like from Hearth's perspective, considering your partners' collaboration within local community? What's that look like in the next 6 to 12 months?
It's stabilizing those we have currently to age in place and with dignity, and also, as Andrew said, to make sure that we provide more resources and services for them in terms of advocating and getting whatever finances that we can do to provide more resources and services for our residents. And that can only happen on a state level and federal level.
Sure. I think one of the messages I've heard in the last 6 to 12 months, Stacy and others, is focusing on public policy, what we can do to impact legislation, and data helps with those conversations. So from your perspective, what kind of rooms does Hearth need to be in to have these conversations and move these policies and legislation forward?
Well, I urge LaTanya's continued involvement with our member advisory board. And we hope to be bringing more people into the contingency planning that's going on in the state. We were also part of, as was Hearth, the older adult summit and the kind of ongoing planning and policy work that is happening there. So I think it's going to continue to be important for Hearth to be involved in that.
Nimo, from your perspective, you mentioned adjustments. We've been here for a little bit. What is Hearth's story coming to today? Since from day one when you started with Hearth to today, how has Hearth adjusted to what's going on within the world, locally, from the federal level, from your perspective and your lens?
So there's a daily crisis that is invisible to those who are not doing the work. Speaking from a personal experience, I started as a clinician with the agency. I get to watch as I grew into my roles, what Hearth does and what we adjust to daily basis in terms of from providing resources that is decreasing on a daily basis, making our older adults are aging and they're required to move to a higher level of care, which at times is very difficult to find a placement for them. So as an agency, we try to keep them in place, but by reaching out to outside agencies to provide resources and to keep them in-house so they can at least age in place, even though they need a higher level of care. So Hearth is on a day basis, we are moving around to make sure that we provide enough disciplines to the needs of our residents.
Well, you had a slide that had a lot of data on it. For me as a reporter, I would always scrutinize data because if it's 90% of this, it's also 10% of that. What is the data not telling us that we should be focused on? There's a story behind the data, right? Because data can be used to tell your perspective of your story, right? And for me, my perspective, our job is to carry that white flag, to tell the story of the Lisas and the woman on the couch.
Yeah.
So how do we as an organization take advantage of this wealth of information to talk to our legislative partners and move the story forward the way that we've been here? Because other than Andrew, I see an Excel spreadsheet and I see Greek, right? But for me, what's the story here we should
Well,
focus
I think there's a critical story for you all to focus on that we're not getting enough data on is that quiet, hidden homelessness of older adults. I mean, I know, and I'm sure our legislators will confirm this, I know when I go and meet with legislators now, even who cover suburban districts, they say, yeah, we hear about the older couple in their car behind the Walmart parking lot. So there's a lot of that. I know when I've helped with some of these homeless point in time counts, we're, start with people in their cars. And I suspect a lot of the folks in their cars, and when I've gone with homeless outreach workers, they said, like, those folks are not coming necessarily to our outreach programs. They're not defining themselves as homeless. It's fine, but what happens then when the car breaks down and you're spiraling down, or you're older and you have more health issues? So we don't have much of any data, but that's a critical story that we need to understand.
Question? Yes.
I'm so glad you brought up the COC because that has been on my mind since it came down, and it is such it flies in the face of data which shows that housing first and long-term housing is stability versus the idea, and some of us have been in this business for a long time and saw transitional housing not work. So Is your map saying that if that money doesn't come through, those people then become homeless?
Yeah, so this is a really hard one. I mean, I have been in literally gut-wrenching meetings. I was in a meeting recently in Boston. Like, what does this mean? If, and there are different scenarios. Will we get 30% of the possible money, or will we not? And this, I didn't go into all this is called the HUD Continuum of Care funding. And how do you plan when we know we're not getting 100%? That there's no scenario that has us getting 100%. And I won't get into all the details. I'm happy to talk to people offline about it. But HUD has a lot of leeway. We anticipating some. There's also litigation. What does that mean when you're in litigation and you're, think of Hearth's partners out there who depend on this money to pay rent to landlords. Do you send next month's rent when things are in litigation and you don't know if your contract's going to get renewed? Like, what do you do? So it's a very tough time. What do we start? How do we start working with the people who live in this housing? What kind of, and the landlords? There's a lot of uncertainty. We're going to be doing everything we can to preserve tenancies, save units. We may have more people who need to be kind of moved to other housing if that's available.
And then I had sort of a larger follow-up question, because this is a national issue. Are there organizations that you're part of just within New England? Like, should Hearth also be looking for partners within New England as a whole?
Well, we've certainly been much, much more involved with our national partners, National Alliance to End Homelessness, Corporation for Supportive Housing. So it's been done less kind of there are kind of cohorts. Yeah, should Hearth. It's heavily been the organizations that directly get these funds. Hearth is indirectly, but it's really affected. And we all are. We're all in the same ecosystem. But yeah, I think we have to keep our eye on this and understand the impact is national.
Follow up, Nimo, for that? Any other questions? Right.
This is a whole room full of people who believe in the cause and the mission. How would you guide me as an individual to influence the 99% of people, forget even other states, even in Massachusetts? Because when I started to talk about the winter walk, I was astounded at how many people reacted positively to me. But they didn't know anything. People don't know anything or even want to get involved with supportive housing. They've heard of affordable housing, but what would you say? What do you do?
I urge you to be a messenger, because I fear one of the things that happens is that when people see rising homelessness, more people out on the streets, and the tragedies of our kind of opioid epidemic, and people in crisis for mental illness. Unfortunately, there's some people like, oh my gosh, there's nothing you can do. This is awful. Government's not working, right? So you are the messenger of what does work, of supportive housing, helping people understand that, helping understand that you can get behind those solutions, and actually the data shows it, that they support the organizations that are doing this work. They elevate these issues with their legislators. We've been talking as we strategize, this hits locally. How are we engaging mayors? Right? Because, HUD wants to walk away. The mayors are going to be dealing with what does this mean now in our communities.
We have a question back here. Yes, sir.
41 years ago, I stepped away from my country to defend it. And I have a permanent souvenir from the Philippines. My wife lived in a paradise-type atmosphere. And because she's never experienced the brutal, bitter cold of Boston, she got a side effect or something like that, and her right hand is like permanently numb on one finger, and it swells up. I took her to the Boston City Hospital where I was born, and when they found out that we were homeless using 39 Boylston Street, they basically treated like trash and forced us out. They said, well, we ain't got no services for you, you know. I have the discharge papers. They made up some kind of issue. If I try to apply for a money position, like in a bank, or if I try to apply for a position at the newspaper, which I used to hawk and sell 18, 20 something years ago.
Nice.
I would be vetted, and I would be background checked, and I would have routine inspections. Do you have any way of doing those type of routine inspections, such as like the undercover boss type thing, of setting and looking at the treatment of the homeless? Both my wife and I have our Mass Health. My wife is having a difficulty getting her Mass State ID. I grew up with all the Kennedys. I grew up with Paul Saunders. I grew up with Chip O'Neill, and a couple other heads of city transportation urged me to run for governor. Instead, I stepped out and raised my hand. I'm wondering, is there any place that my wife could go, being a foreigner, a permanent resident, but still a foreigner, that she could get top good medical care and assistance with things where they fall through the cracks? I can't stay at the veteran shelter because I'm married. Is there any place, not just Boston, Malden, Everett, Revere, is there any place that my wife and I could go while I'm waiting? My tax voucher came through, and I'm just starting to get heads up on public housing. And my wife doesn't know the city, she doesn't know Boston. I'm just looking for contact people, such as this young lady here, to kind of guide me around, because I've been away from my birth city for so long.
Can I share one? Because you're a veteran, there are certain housing authorities that have a higher priority. Cambridge would be one of them. And typically they expect you to be a resident. They give veterans a higher priority. And because we don't really have a lot of veterans in need any longer, if I were you, I would look for any affordable housing authority that has veterans as a preference. You'll bump up pretty quickly.
I'm not computer literate. I'm wondering if there's somebody that...
It must be after.
Well, if I understand, you have, the lingo is VASH, so you have that's a housing security. This is one of the last resources still available to support veterans. It sounds like the challenge is, where do you stay now until you can use that?
I'm over at the Night Center.
Okay, right, but somewhere more stable than the Night Center, right, because that's one of the few places couples can go.
My wife is 64 and I just turned 61.
Yeah.
Sleeping on the floor is not
Right,
very
that's
good.
what the Night Center is, you see on the floor. I mean, we can talk offline
Yes, I understand.
about, there are potentially places for couples, but I do want to just flag a few things. One, you bring up an important issue, that there are couples that experience this, and where do they go? And then secondly, the concerns like you're describing, like people just getting bounced around, you know, like this pinball game, and discharged, and kind of, which just makes it all worse.
There was a couple of police managers that said, just don't say you're homeless. And when they put down the address you live in, it's 39 Boylston Street. That's St. Francis. If anybody is aware of that, 31 Walker Street, again, that's the Night Center. Once somebody starts catching on that there's a lot of people living at that address. They realize that it's a homeless and we get garbage treatment.
The last thing I'd say on this, and this goes back to, I think, the kinds of partnerships, like the folks at the staff at Hearth are hearing these stories, like what is happening and how people get bounced around. And then our, like Mass Housing and Shelter Alliance, our work is like, and I won't get into like discharge planning and inappropriate discharges. We're trying to take all of what you see on the front lines and then do the kind of systems work and take this to the nutrition. What is going on? Why are people being put through this?
I'm afraid that my wife might lose one of her hands because it's affecting her finger. It's going down in the palm of her hand. Someone said Mass General and just don't say you're homeless. But and like I said, we both have Mass Health. I don't know where to turn. I don't know what to say.
Well, I'll tell you what, you are absolutely in the right room, number one. Number two, thank you for sharing your story, because that's, thank you for your service, and it's an awful situation you're going through. But you're in the right room here. Let's have some conversations and see if we can get you connected to the right people. You did have a comment, question?
Yeah, sorry.
Thank you. Thank you for that.
Quickly, so this is one of the areas that legislators really help, cutting through the red tape. I represent Waltham, and I have over, on average, 1,200 constituent cases a year, different things. So if you talk to someone here, and they will either connect with the local legislator or myself, Senator Jalen, and we can help cut through the red tape of all those different areas. And it's my understanding that if you're a veteran of public housing, you go to the top of the list. Even above pregnant women, you go to the top of the list. So, and it is, like you said, there's very few veterans that are not housed. It's because of choice due to things like mental health and substance abuse.
Excellent. So you're in the right room. Let's have some conversations, get him connected. Absolutely. And his wife, thank you for sharing the story. We're just about at time here. I just want to thank Nimo and Joyce for sharing their stories. One more question? Yes?
The only other one is Boston Housing Authority has 10 to 12,000 units of affordable housing. There are certain HUD programs where they have failed housing and looking for redevelopment. They can turn them into RAD, housing voucher subsidies. Is there any talk with the Boston Housing? Are they here in this room? Because they are the Godzilla of housing, and that they have a resource. We've learned just dealing with Hearth that it takes a lot of management to keep our efficiencies. They have enormous capacity. They have great advocates in Washington and others for them. Are they part of this picture? Because if they were to look at their own housing and maybe carve some things off, turn them into these vouchers that places like Hearth and others can create housing that do supportive housing for those in need, even for those in the Boston Housing Authority developments who can't live there independently any longer. Because I do a lot of walking, and I go out of my way to talk to homeless people. Many of them were in the Boston Housing Authority at one point, and they're living under bridges now, and they need unbelievable help. Nimo knows this, and they shouldn't be missing from this. If we're talking about this advocacy, nobody knows HUD better than the BHA.
Well, funny you should say that.
Yeah.
So in a meeting just earlier this week, we were looking at contingency planning within the city of Boston. We said, we've got to bring the housing authority to the table. So yes, we're bringing them to the table at the city level, the state level. We're asking the state to use its role as it is kind of a state housing authority to bring more of the housing authorities in. And then nationally, I will go into the issue of RAD, but long term, how can some of these kind of conversions happen to save housing?
Thank you, Nimo. Thank you to Stacy. Appreciate it.